To a question by Senator Limmer. Senator Limmer.
Thank you, Mr. President. Senator Torres Ray, there is a question about the collection of data in contracts with outside sources in your bill. I still don't know today who will have access to that data. Could you tell me what entities may have information shared to them regarding the data?
Senator Torres Ray.
Mr. Chairman and Senator Limmer, I believe that we talked about this earlier. This bill does not change any provisions with respect to sharing of data and information. This bill is intended to review the categories of race and ethnicity. But furthermore, what this bill is about giving the opportunity to DHS and the Department of Health to really look at the subcategories within race and ethnicity. So what they will be doing is basically looking at an inventory of those categories. So when you look at categories, you simply are looking at, for instance, a number. An example will be that they will be looking at all in numbers. The black category, let's say if they have 2,000 children within the black category, and then the analysis about subcategories within race and ethnicity will be around how many subcategories within that African American or black category need to exist. In Minnesota, we argue that there has to be a new immigrant black category within that because we have an influx of new immigrants that are black that are not African American. That's just an example of it. Within the Asian category, for instance, today in Minnesota, there are 38 subcategories that are contemplated within Asian. Not in all of those categories we have overrepresentation or disparities. So collecting the 38 categories does not make any sense because we don't have subpopulations within the Asian population that are large enough for us to have 38 categories. So within that population, the analysis that needs to happen is that they are going to have to figure out what categories within the Asian category, for instance, need to be expanded. We have a large Hmong population, a large Vietnamese population, and then the analysis will come, do we have overrepresentation within those categories that require a further analysis, for instance, to work on prevention. So the analysis of ethnic and racial breakdown does not really go back deep into figure out individuals per se, but rather numbers. And the analysis that is going to be done now with this bill is really contemplating whether or not we really need to look into the subcategories for analytical purposes only. So there could be, Senator Limmer, there could be in the future a need to come back. The Department of Health and the Department of Human Services may come back to us and say, now that we have decided that we have to do these subcategories within these categories, we need to dig deep into who these individuals are, and we need more information. So they will come back to us and ask us for permission, but I am not sure about that yet.
Mr. President, thank you, Senator Torres Ray. In my review of this bill, I understand that the bill requires the Commissioner of Health and Human Services to conduct an inventory, like you suggested, on health-related data that's collected, but it's not limited to just healthcare programs and activities. It's also collecting vital statistics, disease surveillance, registries, and screenings. Now, registries generally have information that would identify individuals. And if we're passing information and collecting and expanding these lists, then we're expanding the data on individuals. And the question is has this in your bill, can this information be shared with others? And who would that be?
Senator Torres.
Thank you, Mr. Chairman and Senator Limmer. The intent here, this information is already in the hands of each department. They are not to share information because the only intent here, I don't know if I am not being clear at this, the only intent here is to determine whether or not that information that they have needs to be granulated into subcategories in terms of ethnicity and race. So they are only making the determination based, they don't need to share that information with anybody. They just need to analyze it and figure out, once you have this inventory, obviously they are able to see it, right? So they are able to see that they have a group, a large group, let's say, for instance, of African children, African black. Right now, the only category that we have is black, of black children who have high incidence of autism, for instance. There is an anecdotal argument today that within that category, there is a large category of African children who have high incidence of autism. That anecdotal argument has been coming back and forth between schools and counties and hospitals today. By conducting the analysis, what they will do without sharing information with anybody, with doing this inventory, they're going to be able to dig deeper into, do we have a higher incidence of autism within that black category? Do we need to really dig deeper into figuring out if there is a separation between African American children? Now, they do this analysis. They don't share this information with anybody. And so if they determine, based on the anecdotal data they have right now, that they need to separate, then they're going to have to figure out a way to do it. And then they might be able to look into subcategories that really help them do the analysis to really talk in more, really understanding better some of the assessments, for instance, and some of the screening processes that are being done on African children. So there is no, this is, there is no provision in this law that basically says that they're going to be sharing with anybody. They are going to be doing their own analysis. They are going to analyze the numbers and present to us a recommendation as to whether or not this data needs to be granulated. Some data will not need to be granulated, but some, especially in health, we are arguing a lot about health disparities, so we need to figure out if granulating data give us an analysis, a better opportunity to do in-depth analysis, especially to do some prevention and really targeting dollars in terms of treatment.
Senator Rosen.
Thank you, Mr. President. And will the author yield, please?
Jimbo yields. Senator
Thank you, Mr.
Rosen.
President. And Senator Torres, with all this information and this data being collected into subcategories, and I see that it just went to health, housing, and family security. Was there a fiscal note that should have been offered on this or asked for on this? Because this is looks like a lot of information that needs to be collected, and perhaps a lot of FTEs used to collect and organize this information.
Senator Moi. Senator.
No, it's so definitive. I think we should do.
Thank you, Mr. President. Senator Rosen, you are correct. In fact, this is quite an expensive ordeal. This was funded. The department, in the process of doing this, I was approached by several organizations who have been conducting some analysis on their own and had funding coming from foundations. And then when I invited the groups to come together to talk about the need for this, we found out that the Department of Health has already received a significant grant from the federal government to do this. And so what I decided to do was to invite them to see if you know, this beginning of this analysis that was required by the federal government could be utilized to come later on to us to find out if more work needs to be done. So, in fact, a lot of this work is the reason we decided to move forward this year, and all of these questions came up in committee. And that's why we didn't go to your finance committee, because it's already funded, and the departments came and testify with regards to the funding received by the federal government.
Senator Senjum.
Thank you, Mr. President. Would Senator Torres Ray yield? Senator Torres Ray, I just have one quick question. I think most of us, either before session or during session, will meet with our county people, and they will tell us no more mandates, and we'll ask them, are there any we can get rid of, and they'll maybe give us a list. But my question more specifically is this a new mandate on the counties in terms of collecting this information, or is this somehow all done at the state level?
Senator Torres Ray.
Thank you, Mr. Chairman. This will be a collection of existing data, and it will be an analysis. I just want to make sure that I explain this correctly. This is an analysis of existing. They will be coming back, Senator Senjum, to tell us, you know, existing data is not enough, and maybe we need to dig into further information, but that's not the intent right now.
Senator Senjum.
Thank you. And so, Senator Torres Ray, this data is really already being collected, if you will, through the process, and so we're just going to better look at it. Okay. Thank you very much.
Further discussion. Secretary will give the bill its third reading.
House File 3009, a bill for an act, Senate File 3009, a bill for an act relating to eliminating health disparities.
Secretary will take the roll. All senators having voted, desire to vote, Secretary will close the roll. There being 55 ayes, 11 nays, the bill is passed. It's title agreed to.